Good afternoon, everybody. Thanks for attending today. Hopefully, we can get out and get some sunshine before too long. Hard to believe a year ago today we were going home and wondering what next week would bring. And lo and behold, on Saturday evening, made a bunch of phone calls saying that we would be going remote into this world of the pandemic that we thought at the beginning we were going to be remote for a couple of weeks and turned into a period of time rolling through tremendous amount of work. I want to thank all the staff and folks for their tremendous amount of work. But that brings us to today. And we have a presentation specifically on vaccination information. And I'll do a couple of introductions here in a second. Just a couple of housekeeping pieces that I'd like to talk to the staff about. One is, for those who are conspiracy theorists who think we picked the dates on these vaccines, we have been championing the cause to get it here as soon as possible. So really the choices were we either get it the first shot in March and the second shot in April, or the first shot in April and the second shot in May. So, we don't determine those days. Those are the dates that were provided to us. A couple folks had questions about if I'm not certain about the second vaccine, do I pull my name off the list? Now, if you know you're going to be here on March 27th, please stay on the list, and then we'll get some instructions to you about the second part of the vaccine. If you have specific considerations that need to be, this is not the form for that, so please reach out to myself and or Pam Stimson related to individual concerns. But without further ado, today's presentation really is on the vaccine and gaining some understanding about what the vaccine is, how it works, and pieces that you should become familiar with. Our first presenter today is James Potter, and James Potter is the Executive Vice President of the New Hampshire Medical Society since 2015. He's worked with Dr. Chan and the State School Nurses Association. So welcome, James. And our second guest for most folks is very familiar. We'd like to give just a tremendous thanks to Dr. Rich Laracy from the Saco River Medical Group. Dr. Laracy has been with us since the beginning and continues to do so on a weekly basis. He serves as an advisor on the SAU9 medical advisory team, and we keep up to date. I noticed we just got the latest update about 7 minutes ago. I haven't read the Department of Public Health survey, but I will turn over to Dr. Laracy. Thank you very much, and then it'll go to Jim.
Well, we'll create it a little bit differently. Thank you very much, Superintendent Richard, and thank you for Dr. Laracy for joining us, and Pam Simpson and Pamela Clay-Stone. Thank you, Storm. Thank you for putting this or giving us the opportunity to talk to the staff and faculty at SAU9. Next slide, please, Brian. So a little bit of background. The reason that the Medical Society is in November, we worked with the New Hampshire Division of Public Health Services and to come up with a way, how can we engage all the various stakeholders outside of the department, all the private stakeholders, to help contribute to the vaccine effort. So since mid-December, we've been convening on a weekly basis, usually 100, but up to 400 stakeholders a week, and to promote vaccine confidence, support accurate, consistent information, and foster the vaccines allocation process. To do that, we help promote public buy-in to the vaccines to increase immunization rates. Most importantly, we're trying to act as a force multiplier to assist the division with its communication and allocation plans. We also have at times got out and we try to counter misinformation that does come out. And then as we get into this, we'll be using it to foster among clinicians the startup of the New Hampshire's Immunization Information System, which is brand new. Next slide. These are just some of the sponsors who helped put this together. And so we've been able to do this over the last 4 months. Next slide, please. So here's a quick overview. Questions about the COVID vaccines are good and they're welcome. And that's what this forum and other forums are for. And you have in each of your schools some excellent folks to talk to us in your school nurses. So one, they're a good chance. Others are like Dr. Laracy and those at the Saco River Medical Group and or your individual physician or provider. So they're great resources to get additional information. Now, when we talk about the reason for widespread use or getting vaccines, it's really about getting back to life. It's not getting back to normal. I want to emphasize that. Just when things like this, everyone has one of these. When that changed and they came in, that's the new normal. So there will be new normal, but it's those things that you probably miss right now is working on a consistent basis with your students. It's getting back and being able to engage on a regular basis with your family and friends. Those are the things that we miss, and that's what we're trying to get back to through widespread use of the vaccine, is getting back to life. So we're going to go first through a couple of the selected FAQs, and I'm going to have Dr. Laracy do an overview of the vaccines. We'll then take your questions. So there's a Q&A box at the bottom. Any question that you have, just put it in there, and we will try to address those. We've already had some, thank you very much, and we'll also try to wrap those into our discussion period. And as you've gotten a notice from Superintendent Richard, right now, it appears that you're going to have a vaccine clinic at the Kennett High School, starting the first dose on March 27th. The second dose is scheduled for Saturday, April 24th. And it appears that you're going to be working with the Regional Health Public Health Network and going to be using the Moderna vaccine for your vaccine supply this time. Next slide, please. We're going to just go through. I'm hoping that you got a copy of these FAQ vaccine. If not, we'll make sure to get you those. But there's a lot of questions that we worked with the New Hampshire School Nurses Association on and try to get to most of the questions that you have. And what you don't get to, we'll try to get to today if they're not a part of this. We focused on a couple areas. Next slide, please. The first we know is in the school population, there are more individuals, both staff and faculty, who are of childbearing age. So we wanted to talk about if I'm pregnant or lactating or would like to have a baby, is it safe to get the vaccine? Short answer here is the three kind of main bodies here around that support women in pregnancy are the American College of Gynecologists, the CDC, and the Society of Maternal Fetal Medicine all recommend that women be offered the vaccine, even though they weren't part of the clinical trials per se. What's happened is I think about 60 women have become pregnant or part of at least the Moderna vaccine process. So they're following up with those individuals to get more specific information. But generally, it's thought to be very safe. The vaccines work really as training our bodies to develop antibodies to help prevent future illness. This is not a live virus, and it does break down very quickly once it creates the immune response. So it's given a shot into your arm, into the muscle, and right there it starts to essentially create the immune response. The vaccine doesn't, because it breaks down so quickly, it doesn't cross the placental barrier, and so it won't reach the fetus. However, the important thing is that the protective antibodies that you do develop can pass to your baby and can be passed through breastfeeding. And that's important because it does convey to them both some immunity. There's no evidence that there's any fertility problems from this or any other vaccine today. And the other thing I want you to consider too is that there is an increased risk for severe illness if you contract COVID-19 while you're pregnant. So while they haven't had conclusive evidence that it's safe. I think you have to weigh that, knowing the recommendations and the evidence that we have so far saying it's safe. Next slide, please. The other issue that's come in is about vaccines, about have allergies. Is it safe to get a vaccine? And yes, generally, if any allergies you have to medications or bee stings or food or pollen, it should be safe. It wasn't based, or these vaccines are not based on or developed with preservatives or eggs. And right now, even though our talking points say 5 million cases have resulted per million, or 5 cases per million, it's actually gone down to 4 with the most recent information. That's because the vaccine is getting really widely out there. And so this is similar to most vaccines that are out, and actually on the lower side of that for severe allergic reactions. However, if you have a history of an allergic reaction to a vaccine or injectable therapy, then what we're going to want to do, we're going to treat you as a precautionary case. And there's some guidance that your school nurse will know about. And I believe it's HAN 36, it's the previous one, that goes in and has some information about walking it through. But what we do is if you've had something where you know you've had an allergic reaction to a vaccine or injectable therapy, then consult with your doctor, get some additional counseling. And then if you proceed, they'll typically hold you for a little longer period. Usually up to at least 30 minutes, just to monitor you, make sure everything is safe and you don't have any kind of anaphylactic reaction. That's what we're worried about mostly. Next slide, please. So what are the side effects? So you're not getting sick. The side effects are really from you really just by building the immune response, by the immunity. So the common side effects include injection site swelling, some pain, fever, chills, tiredness, headache. They also might be associated with some muscle or joint pain. I had that, or swollen lymph nodes. So my wife had a little swellness, a little tenderness up in her lymph nodes on the same side as the shoulder that she was injected on, as well as nausea and or just kind of not quite feeling right. That's typical. But the bell curve on the reaction time is usually pretty solid around 3 days after the vaccination. And it typically lasts for a day or two. That was in my case. The side effects are more common in the second dose. And that's because your body already knows, it's already built up some immunity and it recognizes it. So typically, you're going to see a little bit more reactions from the second dose, or if you've had COVID already, because the vaccine, or essentially the antibodies will recognize that. So you might have a little bit more reaction on that first dose if you've already had COVID. Again, the serious reactions are very, very small, 4 in 1 million. Next slide, please. So the last slide we're going to touch upon here is, if I have side effects, do I stay at home or do I need to get tested? Again, the initial effects are really from your body developing antibodies to create the immunity response. So this is a good thing. But don't be worried if you don't have a reaction. It's different with everyone. Younger folks who have stronger immune systems have tended to get a little bit more of a reaction. Again, that's the second time. But generally, if you don't, that's okay. But it's really about, that means that the vaccine's working, you're developing those antibodies. So should that keep me from home? Not necessarily. You're doing it on a Saturday, so that will give you a little bit of a grace period. However, if you have a fever, then the recommendation is stay at home that day. But it's not necessary to get a COVID test or to quarantine. However, if you have respiratory symptoms, cough, dry cough, other symptoms related to COVID, such as loss of taste or smell, those aren't related to the vaccine reaction. And if these symptoms persist, then you want to start to think, well, maybe I should go get tested for COVID. Contact your physician and then start to follow the protocols for quarantining or contact tracing. So next. So I'd like to introduce Dr. Laracy. He's going to talk a little bit more about the vaccines right now. There's a little bit of background. I know that you've all worked with him a bunch. So Rich, thank you very much for joining us. And Brian, if you'll give Rich the ability to share his screen.
Thank you. All right, thank you. Thank you very much, Jim. Well, that was a great synopsis, so I won't have much to add to that. But I wanted to talk about, let me just try to get this down here. Oh, it's right in the middle of my, all right, and here. All right, so I just wanted to talk a little bit about what the actual vaccine is and how it came to be made. So what an mRNA vaccine, it's a new type of vaccine. And what it does is it's used to produce a protein. So mRNA is in our, we have mRNA throughout our body, and it makes proteins in our body. What the scientists found is they found that the genetic code for the specific protein that surrounds the virus particle, the COVID-19 virus particle, and it's the thing that we always see, those red spikes. It's called the spike protein. You see on the outside of a picture of the COVID particle. And so what that spike protein allows the COVID particle to get into our cells and infect us. So the scientists were able to obtain the genetic code for COVID-19 and were able to produce that protein. And so what this mRNA does, this vaccine is, once it's injected into our muscles, into our muscle, it causes our body to produce this protein called the spike protein. And once our body starts producing that, it sees it as foreign. So our body's immune system starts to send antibodies and starts to produce antibodies against that protein. And so that we have enough, so what this vaccine will do is it allows our bodies to produce enough antibodies so that if we get infected in the near future or in the future with COVID-19, it'll see that protein on the outside of the virus particle, know it's foreign, realize that it will send antibodies, and we already have the antibodies because we have the vaccine. So it sends antibodies and it causes the destruction of the virus itself, so you will not get infected. This vaccine is, like Jim had said, it goes into our body, but then our body takes care of it, and it allows it to leave the body within hours to days. So it doesn't stay around in our body. And like some other vaccines, some vaccines are made, or a lot of vaccines are made from viruses, and some are made from live viruses. But this is not made from the virus itself. So there's no way you can get COVID-19 from getting the vaccine. There's absolutely no way, because the virus is not being injected into you. And there's also no way that it can get into your DNA. Our bodies would have to have a certain enzyme to be able to do that. And we cannot our bodies don't have that enzyme. So there's no way that the mRNA can get into our own DNA. And again, once the mRNA vaccine is in our body, it quickly breaks it down and then gets rid of it. This I just wanted to go over quickly, because a lot of people initially were concerned that the vaccine trials were so quick that they only took 11 months. So people thought, geez, is this too quick? Was enough research done on these? And the reason it only took 11 months is because most vaccines are very difficult to make. We have to either use a killed portion of a virus or a live virus, and that can take years and years to produce. This is making mRNA, and scientists already know how to make mRNA. It's just made out of something called nucleotides. So you can just get that in the lab and produce this. So it was very easy to make. Also, the safety trials were able to be run continuously. Normally they have to be run first, second, and third. These were able to be run continuously. So that saved a lot of time. And one of the biggest time savers was that it was funded, the research was funded by the United States government. Normally, vaccine makers have to go out and fundraise for the money for research and development, and that did not have to be done. I won't talk about the Pfizer because you guys will be getting the Moderna. I got the Moderna. So in the Moderna, it was a very large safety trial, an efficacy trial. It was over 30,000 study participants. And just the quick thing to know from this is half of those, so about 15,000 people received the placebo vaccine and half received the actual vaccine. And in those that received the placebo, 185 got COVID. And in those that got the vaccine, only 11. So it showed that it was a 94.1% efficacy rate for this vaccine, which is great. It's amazing for a vaccine. And the other really important thing, especially with the Moderna vaccine, is in the safety trials, there was 30 severe cases of COVID-19, severe being they were hospitalized and in the intensive care unit. All of those were in the placebo group. So there was no one that got the vaccine that went on to get a severe case of COVID. And Jim had already gone over the side effects. Again, routine side effects would be sometimes fever, muscle aches, joint aches, feeling fatigued, headache. This vaccine is approved for ages 18 and up. The Pfizer is approved for ages 16 and up. And just like Jim had mentioned, it's not yet approved. There are safety trials going on right now for children, pregnant females, breastfeeding females, and the immunocompromised. But it is recommended by the CDC that if you are a female and pregnant or lactating, and you're in one of the groups that is eligible, that it is okay to get the vaccine, that you should weigh the risk and the benefits, but at this point, it looks like the benefits would definitely outweigh the risks. And Jim talked about these. We'll monitor you for everybody for 15 minutes after you get your vaccine, just to make sure there's no immediate side effects. And real quickly, you'll be given the opportunity to do something called vSafe. It's this software you load onto your iPhone, and it will text message you daily for 7 days after the vaccine, just checking in, seeing if you're having any side effects. And then once a week for 6 weeks after your first vaccine or after your vaccines. And so it's a great thing. And then it's, I think, every 3 months for a year. So it's a great thing to keep the CDC informed of any potential side effects. The other thing I just wanted to say is that the vaccine is, if you've had COVID-19, the vaccine is still definitely recommended to get. And the vaccine does not affect any results of future COVID tests if you needed to get a COVID test after the vaccine. So really, just bottom line, I think this vaccine is so safe. It's been very well tested. I think this vaccine could definitely help us get to herd immunity. And that's where we have 75 to 85% of the population that has antibodies to the COVID vaccine. And that's when we could hopefully start to get back to, like Jim said, not normal, but a new normal for us. So I'm really glad SAU9 is getting this vaccine, and you guys have the potential to get this. So awesome. And I'll put it back to Jim. Thank you.
Thank you very much, Rich. We really do appreciate it. So now this is your opportunity to ask us some questions. We'll go over a couple that we've already gotten right now. And I'll just take the first one here, but use the Q&A box if you'd like to type any questions. You can do it anonymously if you'd like. So just type any specific questions you have. But One question that came in advance is, may I request the specific vaccine? The answer is no. And actually, all scientists would tell you these are all really good. And so one between the other, it's important just to get one of the vaccines. But I will tell you the mRNA vaccines are about the closest thing we have to a modern day miracle. I mean, it's for both the mRNA vaccines, it's really, if you get it, there's about 100% chance that you're not going to be hospitalized or die from it. That's what the evidence has gone thus far. So these are really, really effective, super effective as we move forward. Another question is here, we'll just kind of go through some of these. I may have, if I've tested positive for COVID, and I think you addressed this earlier, Rich, is that how long do I have to wait before I get the vaccine?
So it's a minimum of 10 days after your symptoms have resolved. And in fact, it's a minimum really of 10 days of your isolation and then 10 days of your symptoms resolving.
Great. Question that just came up here is, when we come to get the vaccine, what identification or other paperwork will you need? And that will be given out to you through the superintendent's office, but typically it's they will know you because you're doing a closed pod, so that will be much easier. But typically it's ID and some proof that you actually work for the SAU. But I think the way that they're handling this one is that you're all kind of coming in and registering beforehand, so they should know you. So it's a little bit different. If you move into the, for some reason, say you get the first vaccine or and you can't get the second, then they'll either try to do through the regional public health network something with the SAU, will have an alternate date, or they'll ask you to go through the state site, which is now called the VINI. And VINI will have you register and you'll go to one of the state fixed sites that they have. So just a little bit back to it. And then there's another question. Can I take Advil or Tylenol after the shot? Go ahead, I'll let you take that one.
Okay. Yes, yes, you can. And there are some questions whether or not doing so might decrease the effect, the efficacy of the vaccine itself. We don't have enough research to say you shouldn't take it at this point. Just anecdotally.
The one thing, the one thing I have heard, don't take Tylenol or Advil prior to getting the vaccine. So don't do a pre-vaccine dose. That's where the evidence is that may minimize the initial response. So we want to have you develop that immunization response as effectively as possible. So the evidence is mixed, but typically they say at least initially try to stay away from it. Later, a couple of days into it, generally it's, if you're having symptoms, fever, muscle aches. Is it advisable to lay low once I have received the vaccine? And having had it and others, you should be able to go unless you don't feel it. Now, I will tell you, my wife went and hiked one of the 4,000 peaks the day after and asked me if I wanted to go. And I said, I don't think that's probably the best thing I should be doing right now, but you go have a great time. So yeah, I think you just have to, you are going through an immune response, your body is responding. So I think that you can go about your normal activities, but I wouldn't do typically things that you're going to overexert yourself. Is that what you'd recommend, Dr. Rick?
Yeah, I agree.
Will the vaccine interact with other medications that I'm taking?
No. Oh, go ahead.
Good. No, you got it.
Yeah. No, it hasn't been shown in any studies to interact with medications.
Great.
So you should be clear to continue taking your normal medications.
Great. Another question here is, do you have to receive the second dose exactly 2 days after the first one? Well, it's actually a little bit longer than that. So for the Pfizer, it's 21 days, and the Moderna, it's 28 days. So the scheduling that's been set up through the SAU takes it into consideration. There is a little bit wiggle room, but typically that's what they're trying to get close to that within about a week of that 28-day period. So that's what you have set up right now. And I think, as the superintendent mentioned, if you have to make accommodations outside, then those are the things that they'll want to know. So we make sure that that second dose is delivered into that particular time window. Can you still get the virus after being vaccinated?
So you can, and the research is ongoing with this. Your chance of actually having symptoms is very small. So 94% that you're not going to have symptoms. It's still possible you could be infected. We just don't know right now whether or not you can then transfer that and spread the virus. The research is ongoing, and I think we're going to have the answer to that soon. So you still can get infected. Most likely you would not get symptomatic, and we just don't know if you can spread it at this point. Most likely you can't, but we don't know that for sure.
There's a question here. I took ibuprofen a few hours after the second shot. Is that okay? Yeah, generally, yeah, I think the answer is yes. It would be.
Yeah.
Just before. Good. There's a question here, and I think Superintendent Richard is responding to this. But can we sign up for the vaccine on different days that don't cut into our weekend or vacation? I think we're trying to set this up as a closed pod for the SAU. So actually, you're getting it on the early end. If you don't do that, then it makes it a little bit more difficult. Because then you'd have to go in through the public system in Vinny, and that's likely to take a little bit longer. So if at all possible, I think we're recommending that you try to do it at the SAU9 clinic and move forward if at all possible. And I think those are questions for Pam Stimson and for Superintendent Richard. After this, you can have those discussions about, if there are circumstances where you're not going to be able to do that. Next question here. Should I skip my morning meds? What do you think, Dr. Lacy?
No, absolutely not. Continue your meds just as scheduled. It will be completely safe to do so.
Great. Here's another question that we had before that was offered. Do I still wear a mask and socially distance after I've been fully vaccinated?
Yeah, real important that you should still do that when you're out in public or in school, and trying to wear the mask, maintaining social distancing. Now, there is new guidance from the CDC this past Monday stating that if you've been fully vaccinated, that means with the Moderna, 2 weeks, it's been at least 2 weeks after your second shot, your second vaccine, you can be with friends or family that are vaccinated without masks on. It also, there's another point to that says that if you've been fully vaccinated, you can interact with a single household without a mask on. So family or friends, as long as it's a single household, and those, even if they're not vaccinated, as long as they're in the low risk group, it's not recommended to do that if they have any high risk conditions.
Great. Another kind of vaccine, is it better to brave it out or not take Advil or Tylenol?
I don't know. So again, anecdotally, as a pediatrician, we do have some studies that show that if Tylenol, not ibuprofen, but Tylenol given around immunizations might decrease the effectiveness. So I really took that, and myself, I tried not to take Tylenol or Motrin. Definitely I didn't before, because it's definitely recommended not to do that before taking the vaccines. And I myself didn't take it after. I'm not saying you should do that or shouldn't do that. I, I wish there was more guidance, but there just isn't. So if you really don't, if you feel like you don't really need it, I wouldn't take it. But if you really are feeling a lot of pain, a lot of muscle aches, or, take it. I mean, if you're really having some side effects.
Right. And the immunity takes a little while. So you may have the initial side effects, but typically it's what they're recommending is it gets to near full strength about 14 days out. You'll maybe increase a few percentages of that going out to 28 days, but most of the immunity is developed within that 14-day period. So that's where they say, well, before you attempt to do anything else, make sure you kind of get past that time. So here's another good question. What is the likelihood of being a carrier of the disease to others who are not vaccinated? So I think this is assuming once I've been vaccinated, what is the likelihood of being a carrier of the disease to others who are not?
I don't know.
Right, I can help there a little bit. So in spending a lot of time with Dr. Chan and Dr. Talbot on these issues, their answers are it's likely to be diminished. One, the vaccine helps prevent you. So even if you do contract it, it is typically a milder case, which what is believed in some of the studies is that you develop less particles in your nasal passages, and that's how it's spread. And so you're not as likely to shed the virus in the same doses if you're not vaccinated. So the thinking right now is that if you've already been vaccinated, even you contract it, your ability to spread that is greatly diminished to others. They don't know that conclusively right now, but that's the thinking right now. So that's why we say get the vaccine. That's why the recommendations, if you are vaccinated and say your parents are vaccinated, then you can come together. And again, there is a health alert notice that we literally took the CDC guidance and was just published literally minutes before we got on this. And what we'll try to do is we'll work with you all and the school nurses and develop, either get that to you or get the, some summary information about that. All right. Here's a question. Is there anything you should or can or do to minimize the side effects from the COVID shot to receiving it? The short answer is no one really knows how you're going to react. So it's variable to the individual depending upon a number of different circumstances. Would you like to expand upon that?
Yeah, no, I agree. And there's really not much to do to help prevent that and to know if that's going to happen to you, because there's a lot of people that aren't having any side effects. And it, like Jim had mentioned earlier, it is being seen that the younger you are, the higher the risk that there might be some regular side effects, that the older population aren't having as many.
Right.
That's just a generalization, but.
So the question is, the Moderna vaccine comes out in a multi-dose vial, right? How many doses per vial, and how would that be managed to make sure that we're not keeping the virus at room temperature for long periods of time?
Yeah, so it's a multi-dose vial. Initially they were 5. I'm pretty sure there was 5 doses per vial, and right after Moderna was released, doctors and nurses were finding that there was still a fair amount left in there. So I think now I'd have to look at that, but the recommendations are you can get possibly 6, 7, or even 8 doses out of a vial. And I am sure that we're going to be following very strict guidelines on how long that can be left out in room temperature with the 6 hours. And we'll make sure this is very safe and that we follow all the protocols.
Great. Have just a few more minutes left, so if you have any last minute questions, please get them in. Is there a chance that the J&J vaccine production ramp up, that New Hampshire would receive that prior to our first Moderna shot for teachers and maybe our staffs to receive one dose and be done instead? The short answer is no. And so there is a big bolus that the state got, and that's what you saw kind of go out at the New Hampshire Motor Speedway. They have it about, I think it was about 11,500, 600 doses. And so most of that big bolus was used up for that particular time. We're not expecting to get really, they'll be getting a little bit. There's, conflicting information kind of coming on how much, but we're not really expected to get another big bolus of the J&J for at least a month. And I think what they're going to do again is probably do kind of a mass vaccination event. So we would say, go ahead and get the Moderna, as soon as you can, and not wait for something down the line as you move. And I think quite honestly, what's going to happen, if you've noticed with the guidance, they're going to be moving into phase 2B pretty briskly. So I believe the phase 2B opens up on the 22nd, and I think they want to get shots and arm shortly thereafter, I think by the 27th of March. So there's going to be some overlap here between 2A, which is just schools, and 2B, which is those 50 and over. And that 50 and over group is going to be a big number, probably the biggest number we've seen. So you really don't want to get caught up on that, because that could push you out months before getting the vaccine. And so we recommend try to get it through the schools program, try to get it early in whatever they'll give you. So that's all the questions. Any final comments, Dr. Larcy?
No, just other than, yeah, I think, and I know this vaccine is really safe, and please consider getting it. It's so important to help decrease the spread of this deadly virus. So thanks, everyone.
Great. Any last words from Superintendent Richard or Pam Stimson?
No, just thank you, folks. Just a quick reminder, if you've signed up with the school to get vaccinated, please, on behalf of the medical community, don't jump ship and try to sign up multiple times. We've heard from Memorial Hospital and other folks saying, please stick to the date that's given and don't double book. So that's a urging from the medical community. Otherwise, thank you very much, gentlemen, for your support and the information.
Great. Remember, these, you should have received a copy. If not, you can ask for a copy of these talking points. So if you missed something we were talking about, wasn't quite fair, these go into a little bit more depth. And you can always go back to particularly your school nurse or your local provider to get more information if you still have questions. But ask those questions. Again, we want to try to see to get as many people as we can, so we can build to that herd immunity in the school team as quickly as possible. So again, thank you very much. Appreciate your time. We're right on the hour, and be well and good luck.